Let's try to paint a picture of really what the consumer experience will look like in 2025 in healthcare, given what we know about the impact of the pandemic, the investment dollars rolling into digital health startups, the role of big tech, the pace of technology change in healthcare. What might the consumer experience look like in 2025?
There's certainly going to be more proactive care delivered regardless. The payers own the insurance, they own the risk mitigation, which is proactively engaging with patients before they start, reaching a level where they have to go to ED visits or I don't know, injured things that could have been dealt with on a PTOT, results in surgery because of lack of, intervention, et cetera. And I think with the rise of RPM, be it, your Fitbits, your Apple Watches, your in-home sensors, along with the rise of RPM kits that manage CHF or recovery or more high acuity levels, and all of the monitoring against that is going to lead to signals that provide more proactive intervention. And the payers have been capitated. The insurance, most employers are capitated against their members, so they want to pay for all this. Hospital systems, because they lost such large chunks of procedural revenue this year, are now trying to aggressively move into the capitation risk management. And so they themselves are going to have to get into this more proactive. It's going to take longer for them to adjust their business model, I'd say. But I think that is an absolute. And, some people might see that as an intrusion of their privacy and over my dead body, nothing's tracking me, et cetera. But I think there's going to be financial and business models and incentives that for the majority of Americans, they're going to say, yep, you can monitor, you can reach out to me, you can try to intervene with my care because it's cost effective and worthwhile to me against these high deductible plans or, kind of other out of pocket expense, considerations. So I think that's probably where things are going. And don't discount Amazon's rise. I think even just this week they announced, or there's rumors that they're now licensed to operate their Amazon Cares, their virtual primary care and their nurse care delivery in home in all 50 states. And I'm fairly convinced that Amazon's going to eventually get in the insurance game and provide all those economic incentives and proactive measurements and device accompaniments. And they're going to have a financial business model that most people, like we've done with most of our consumer lives, I'm willing to give up a degree of my privacy, be it Facebook or Google or whatever other big tech, kind of mechanism we use for free because of the convenience and cost savings that benefits me. And I think Amazon's going to crack that nut pretty wide scale here over the coming years.